Okay, hi guys. I'm here with an explosion of rainbows. The eyelids even turned up for this. And it's all in celebration of my wonderful colleague and what we're going to talk to her about. I'm going to let her introduce herself though, but I will tell you her name. This is Dr. Anastasia Thompson, and she's got stuff. She's got decor as well. Yeah, they're all lining up there. So Anastasia, tell us, who are you?
That's a great question. I wake up every day and ask myself the same question. I am a medical doctor, though I don't believe it myself, an author and an activist in the field of LGBTQIA+ and predominantly transgender rights. And of course, I've got a bit of a passion, or at the very least, an Achilles heel for trying to teach and educate. So it's a pleasure and a
Passion.
privilege
It's a
to be
passion,
here
and
today
it's a
to
passion.
indulge that. Yes, it's a passion. That's correct. That's exactly what I said.
Yes. Okay, so you would normally be doing this with the group in person, and I'm kind of here to represent the student body. I just want to introduce everybody. They've already met her, but here's Dr. Barbie. So this is going to be you guys one day. And she's here to learn about how to navigate this issue and why we should care about it. So let's get started with the first question, which would be, how are sex and gender different? Are they even different?
Yeah, so I think that's a really good kind of starting point for this conversation. And I think to a large degree, a lot of people use the term sex and gender almost interchangeably. And the example I give is like, think about the last time that you went into a store and filled out a form, like for a Clicks Club card, or you went to the laboratory to have your blood tests done or whatever else. We're all very accustomed to seeing these little check boxes, right? M or F. And sometimes the question next to it is sex, and sometimes the question next to it is gender. And this is kind of one of my favorite questions to open with when I am doing the session in person with the class is there a difference between sex and gender? And invariably everyone will kind of say, yes, I think that there is a difference between sex and gender. And understanding that distinction is kind of really important. And of course, you're at a bit of an unfair disadvantage because you are woke and educated, and you are an educator in this field. But what do you think the answer to that question would most commonly be if we said, what is the difference between sex and gender? What do you think people would most often respond with?
So if it were someone who had a little bit of inside information and insight, I think they might say that sex refers to your anatomical bits and pieces, so the way you are born, the equipment that you're born with, whereas gender is more of a societal construct, that you choose, you kind of choose how to present yourself and in which ways, and along with gender goes the various roles that there are, but I think we're going to get into that later. So I think that's how somebody who's a little bit more informed might answer the question.
Yeah, fantastic. So, generally comes down to saying sex is a matter of some or other, something that's biological in some sense, maybe anatomical, maybe physiological, etc., etc. Whereas, and it's almost kind of like a buzzword in society to say gender is a social construct, which, it sounds very cool to say, but we'll actually kind of unpack that a little bit later on and see if we can figure out what it means, because it's great to say the words, but we also kind of have to understand them. So, the distinction that we have here, we speak about M and F, right? And that's male or female. And actually the words male and female are in reference to sex and not to gender. The equivalent that we'd have when we speak about gender would be to say man or woman, right? And then male or female would refer more accurately to sex. The one is derived from the other, the binary that we have around gender. And I don't know, should I explain what a binary is? Do we know what a binary is?
I have no idea what a binary is, Anastasia. Please help me.
Fantastic. Thank you, Dr. Gordon, for asking for assistance there. There is no shame in admitting that you do not know. I'm very impressed that you didn't try to doctor explain to me what the answer is when you're actually not sure of it yourself. And thanks for playing along, because I do know that you do know the answer. But nonetheless, a binary is a system where there are only two possibilities that exist. And for those of you computer geeks out there, you'll know that machine code is a binary of 0 or 1, just as we refer to a binary of sex, male or female, or a binary of gender, man or woman. And the implication of having this binary system is that, firstly, an individual must belong to one of these categories. You cannot belong to neither category. You cannot belong to both categories. You cannot move from one to the other. So that's a binary. And this binary, which is a concept that we are still going to challenge today, the binary of gender, man and woman, is derived from this binary notion of sex, male and female. Now, what do you think are the biological characteristics that actually determine sex? And there's a bunch of them, most often or most frequently more than people realize.
Okay, so did you say the biological things that determine sex?
Well, how do we define what someone's sex
What
is?
someone's sex is. Okay, so that is something that normally happens for the first time at birth, where the expectant parents are told it's a boy, it's a girl, and that is normally identified by looking at the genitalia of the infant. And that's where it all starts. So those are the external genitalia. You cannot come to any conclusions about the internal genitalia like that. So the external genitalia would be one factor, the internal genitalia, the hormonal milieu that is happening in that person's body is another thing. And I'm going to stop there.
Fantastic. So if you would grant me Zoom permission to share my screen, because I
Please.
see that's disabled.
Oh, we cannot have that. Multiple participants can share simultaneously. Please, please.
Fantastic. There we go. Okay, so let me pull up my trusty whiteboard and let's see if we can get this to work in a way that is going to be useful. Okay, fine. So let's have a look here. So we are speaking now about sex, right? Oh, look at my pretty handwriting.
Oh, you're such a
Let's see if I can
teacher.
make that a little bit better. Yeah, I know, I tried, I know. All right, so quite rightly, you said to me that the first characteristic that we would want to look at there would be external genitalia, correct?
Yep.
And external genitalia, and I'm going to use some very grown-up words right now, but we're already talking about, does someone have a penis and a scrotum, or does someone have a vulva, or is there something else that we're not really very easily able to identify? Then again, as you quite rightly said, we have to think about hormones, right? And the predominant sex hormones that we're aware of are estrogen and, to a less degree, progesterone, and on the other hand, testosterone. You spoke about, so I'm going to say that the one that you gave us was internal reproductive anatomy, which is things like a prostate and a uterus, right?
Yep.
Internal reproductive anatomy. Okay. And then we also have everyone's favorite point to discuss, which is chromosomes, right? XX and XY. And lastly, we have gonadal tissue, and this is where I talk about ovaries or testes. So, gonadal tissue, there we go. All right, so we'll play a little game here, and I hope that the class will follow along with us at home. You can play for points, but they're all made up. So what I would do if I were in front of the class right now is I'd say to you all, if you know what your external genitalia look like, whether it resembles most closely a penis and a scrotum, or on the other hand, a vulva, you can put up your hand. And we usually get about 100% success rate. Everyone knows what their external genitalia look like. And if you don't know, I usually tell people to go down the hall to the bathroom. There's a mirror. We can send someone with you if you want for moral support. Of course, in this day and age, hopefully watching along with this video in the privacy of your own home, and you can take a quick look in your pants and see what's down there. The
I
next
think
question
Elmo
that we'd
wants to go
ask.
do that. Elmo's not sure. He's going to go check.
All right, Elmo's going to go take a look at what's going on down there and come back to us with an answer. Then I'd ask the class, how many of you have had your hormone levels tested recently? And this might be just as part of a general health screening or a checkup for fatigue or something like that. And usually we get a fair number of people who are pretty certain, and I'm just going to ballpark these figures, but let's say about 8 out of 10 would have had their hormone levels tested, estrogen or testosterone or whatever else. Then, I mean, I know I've certainly had my hormone levels tested. Then we'd say, what about your internal reproductive anatomy? Do you know with certainty whether you have a uterus and or a prostate? Maybe you've had an ultrasound. There you go. Maybe you've had a digital exam, etc., etc. And we usually get a pretty good success rate on that of around 60% of people who've had such procedures done. Then I ask the class who's had their karyotype done recently and knows what their chromosomal complement is. Right, neither have I, and almost certainly none of our contestants playing along at home will have had this done except in extraordinary circumstances. And then of course the last question is, how many of us have actually had a tissue sample taken from our gonads by needle biopsy, sent to a laboratory, fixed on a slide, stained, analyzed under a microscope, and had that reported on by a tissue pathologist to tell us whether the tissue present is in fact ovarian or testicular in origin. And with the exception of 1 or 2 individuals, that answer is almost always universally no. How certain can we be of our own biological sex? Well, perhaps not as certain as we were before we started having this discussion. So the difficulty here is that when a child is delivered, we look at external genitalia in order to assign a sex to that child. What do you think of that terminology? We assign a sex to someone.
It's it's very much we are making a massive decision about the child's life and future. Yeah, we're in essence we're deciding what we think this person is or isn't. Yeah.
Exactly right. It's something that we do to you. You don't have a say in it. We look at your external genitalia, just 1 out of 5 characteristics that constitute your biological sex. And based on that, we make some assumptions that will affect you for the rest of your life. Now, if I take this set here of 5 different characteristics, and we go analyze a large population group, and we come up with confidence intervals and standard deviations, etc., and we figure out that there are normal values for each of these that correspond to male and female. And we look at your external genitalia and we say, are these male, are these female? And we put a tick there. We measure your hormone levels, your estrogen and your testosterone are in range. You've got the uterus, you don't have any other tissue, you've got XX chromosomes, you've got ovarian tissue, right? You get a full house, you've ticked all of the boxes. How many people in general society do you think will have a tick mark squarely in each box under one of these 2 columns?
None.
Very, very few, if any. Very few. So we used to, when we speak about intersex, we used to say that we were thinking about somewhere in the vicinity of 1 in 5,000 people. If we take this definition of someone who doesn't neatly fit into all of the boxes that are male and female, and we don't know all of them, and the reason for this is because not everyone has the ambiguous genitalia. Sometimes we only determine at puberty, when someone's genitalia mysteriously change shape, that they are in fact intersex. Sometimes we don't figure it out until someone wants to conceive or impregnate someone else that they are in fact intersex. Sometimes we don't find out until post-mortem that someone is intersex. So we don't always know. But if we look at this definition, we say anyone who doesn't fit neatly into each of these categories, we could be thinking of as many as 1 in 50 people. Oh, that's not working. This is very embarrassing that my fancy graphics pen is not. Okay, let's cancel that.
1 in 50.
Let's undo all of that. 1 in 50, right? As many as 1 in 50. Now, we're not all incredible epidemiologists, but you don't need to be one. Does 1 in 50 sound like pathology, or does that sound like normal human variation to you?
I'm going to have to say with a statistic like that, that it sounds like a variation of normal.
It does sound a lot like a variation of normal. So the argument that I would put forth, and this is supported by science, of course, we don't know everything, and we have to bear this in mind. This is a field that we are still learning a lot about. But I would put forward the idea that historically, when we didn't have access to be able to look at all of these different characteristics, we couldn't do chromosomal analysis. We didn't necessarily have laparoscopies and CT scans and ultrasounds, and all we had to go on through the Dark Ages was the appearance of someone's external genitalia. We kind of made the mistake of confusing what is normal with what is common. And that's where this binary notion of sex came from. And again, I'm not an expert on animal biology, but I will tell you that if you look at the animal kingdom, you find all sorts of weird and wonderful, wacky phenomena. They have W chromosomes, they have Z chromosomes. You have hyenas where the female has the phallus and the male has the cavity. You have clownfish that differentiate to and from different states depending on the needs of the cluster. You have animals that impregnate themselves. It is completely and utterly non-binary out there. And then somehow we thought that when it comes to human biology, it's kind of just M and F. And then we use that as a starting point, right? So it's a little bit problematic, at least in scientific terms. What we take from that is just to recognize that the diversity of biological development is far more expansive than perhaps we would commonly want to believe. And this is something that we really need to rethink. And of course, one of the areas where this becomes most pertinent is in what do we do when we are confronted with a neonate or an infant who does have ambiguous genitalia, and how do we deal with that? So as you may or may not be aware, I mean, Shiv, I don't know what they taught you when you were studying. I know that as a medical student in the University of Pretoria who graduated in 2009, I was taught that ambiguous genitalia is a medical emergency and you have to freak out and perform urgent corrective surgery. Does that sound familiar?
That's interesting because we were taught, so I'm a UCT graduate class of 2003, and we might have been taught it that way, but my abiding memory was that it's a medical emergency because it's associated with congenital adrenal hyperplasia and a salt wasting situation. But I don't remember them honestly telling us that there's got to be surgery done to decide either way. But then again, this is UCT, that's Pretoria, you know.
Yeah, exactly. So you're 100% right. Congenital adrenal hyperplasia is potentially a life-threatening medical emergency. And the reason for that is metabolic salt wasting. It's not because of the ambiguous genitalia, and you don't fix it with butchery. But we do know that all too often, parents of intersex kids have been coerced into consenting for genital reconstruction on their children, which often includes sterilization. And it's been sold to them in a variety of kind of like dirty and underhanded ways. So, you know, one of the scenarios that you'll find with some intersex kids is that they have what we call a streak gonad, or basically like mixed tissue in the gonad, or a primitive, not fully developed gonad, or an undescended testes, for example. And often the parents would be told something like, oh, your child has a 1,000 times greater chance of developing a malignancy in that gonad, and therefore we should operate on it. And, you know, this is interesting because certainly if we think about, and again, just to hop on the epidemiology for a second, if we think about the relative risk, yeah, maybe it is actually factual to say that that child has 1,000 times or so greater risk of developing a malignancy. But the absolute risk of developing that malignancy compared to the general population is still absolutely minimal. So instead of it being something like, a 1 in a billion phenomenon. It would now be 1 in a million. And we use that as justification to do a genital reconstruction and remove someone's potential reproductive capacity without even talking to the individual in question, because certainly no infant or neonate is able to consent to genital mutilation. And the reason that it's become so, or that it became so prolific, and there are some countries where it's now outlawed, you can't, as a doctor, you can face criminal charges for operating on the genitalia of an intersex kid in certain places in the world. Not yet in South Africa, so we'll continue to push for it. But the reason for that is because we're so afraid of what happens if this individual does not fit into the binary, this fallacious binary that has been derived from some faulty science.
Yeah, so it's to assuage our own sense of discomfort, and it does not benefit the child at all. I mean, the worst thing you can do is to go and do surgery in that way in a neonate. Can
Absolutely
I pause
right.
us? Sorry, can I pause us for the next segment? Do you want to finish up something before we carry on?
Yeah, absolutely. All I wanted to say, I am keeping an eye on the time as well. I just wanted to say that it makes us as clinicians more comfortable with someone else's body, because we get uncomfortable when we can't fit something into this two-box system. And the reason for that is because we haven't interrogated and we haven't unpacked the system, and we haven't decided, is this really in line with the truth and with our own principles and ethical standpoint?
Couldn't agree more. Okay, I'm going to stop before we go to the next segment.